So what we are going to talk about that how Clinivantage is helping the providers and the consumers of healthcare to improve the healthcare delivery and improve the overall health index of the society. That's the major point which we are going to talk about. So now gone are the days of patients carrying huge files of their reports and x-rays and waiting at the appointments. So if you see that still people, when they go to the hospital, they go to a clinic for any appointments, they carry a lot of reports, they carry a lot of historical data and everything. Now, this data, you can miss a certain part of the data. You can have a certain data which is not relevant for the current episode management. So, what is the solution for this? How you can change this entire scenario with the usage of technology? That's what we're going to talk about. So, EMR, EHR, PHR are completely disrupting the entire healthcare provider network. So they are providing a lot of tools, a lot of technologies where a lot of things which are not possible, were not thought about with the paper records, have been seen that now it's possible. So which was not impossible, we are talking about that it's going to be possible with this thing. So now telehealth was a very relevant technology. People were using telehealth with a remote care management and everything, but now the video streaming and everything. So how the technology has moved not only from a telehealth but to the video stream. So people can use actually their own mobile phones for getting their episodes managed with a remote care management. There is no need of going to the centers where the telehealth and everything is possible. So what you are doing, that you are doing your online video streaming, you are doing the personal user profiles and user registrations. So you can actually use your mobile phone to manage your own health and your episode with the doctors who are available in the remote locations. The specialists and everyone available in the remote locations. So another thing is that chronic care management, like diabetes, cardiac issues and nephrology. There are a lot of issues in terms of managing the care remotely. The diabetic patient who continuously monitors his own sugar levels and everything, how he gets his update on his health, how he connects to the doctor is another major problem. So chronic care management in a remote scenario is another issue which we are going to handle with the technology and the entire practice management. So technology has done a lot of positive impacts on the professional life as well as adding convenience and driving productivity in an increasingly digital workspace. How does this apply to the healthcare? How the technology in the healthcare can be utilized by using various forms that currently available in terms of a connected and communicated available healthcare. So this is innovations of file sharing, collaborative technology. All these are now possible in a healthcare using the various technology platforms which Clinivantage has developed and has been deployed in various countries currently. So online medications, fitness bands, smart gadgets for checking vitals, blood glucose levels, portable ECG are few examples of enhancement in personalized care. So we have this one device with just 6 vitals, and you can use this device at home to measure your 6 vitals, which includes your oxygen, temperature, pulse. It does your blood glucose. It also does your blood pressure and your single lead ECG. So these kind of devices can be utilized, and the data can be streamed across your healthcare provider networks for any kind of an ER or a chronic care management programs. So this is what we talk about using a technology of Clinivantage. So we have a platform. So we have a platform which is a collaboration platform for a complete healthcare consumers as well as for the providers. So we have a practice management solution. We have EMR. We have devices which are different devices. Like I talked to you about the 6 vital device, ECG device. So if you look at how the home care professionals can manage, this is you can say it could be a self-care management program or it could be assisted care management program. So you can actually do the geriatric care, you can do a chronic care management as well as home care management programs running this entire platform into this. So using the IoT devices as well as using the platform, which is the technology, completely cloud-based, accessible from anywhere in the world. So this is you can say a patient self-care. So how patient can use devices, technology at home, and how he can connect to the entire platform, and how he gets connected to the entire provider networks. So the patient requirement of managing its own health, keeping all his records at single access. If you see currently we have a complete access to your financial record, but do you have access to your complete health records easily available, or you're still maintaining a papers? So that's the thing which is differentiate with the My Life as an app, which allows you to maintain entire your medical records, historical, current medications, your labs, your everything onto a single accessible anywhere in the world. So My Life gives you that connectivity which is giving you the ProCare. So the data is being generated by this entire platform, moves to the My Life, and then you have IoT devices where patient is managing his own health and the doctors are looking at him. So you run the entire chronic care management programs as well as corporate care management programs or remote health episodes. So this improves the major engagement with the patient. So that helps all the providers to engage with the patients more, allow them to improve the productivity, improve the care management as well. So I will just show you one video which basically will give you the explanation how the Clinivantage platform is helping.
Let us take a look at this. The Self-Home Care program is designed by the hospital with the help of smart devices, portals, and mobile app development by Clinivantage Healthcare Technologies. The My Life application is downloaded in the patient's mobile phone. The hospital provides easy-to-use smart devices which will capture the various vitals of the patient. The patient uses the devices for self-triaging, and the data captured is uploaded on the My Life application. At the hospital, a care team is assigned to the patient who monitors the various data captured by the patient. The care team monitors the various parameters of the data captured by the patients. If any parameters of the patient get beyond the safe zone range, the care team immediately gets an alert notification of the same. The patient gets the update, and the care team arranges for a consultation with the doctor via audio or a video call. Based on the severity, the doctor can suggest a hospital visit or can provide prescription to the patient. The pharmacy at the hospital also gets an update of the prescription, and the medicines are home delivered to the patient. If there is a need of performing some tests of the patient, then based on the nature of tests, necessary actions are taken immediately. For radiology tests, an ambulance is sent at the patient's home to take the patient to the laboratory, whereas for pathology tests, the hospital sends an expert to the patient's home to collect samples, which will be tested at the pathology lab. In this way, by using smart devices and portals developed by Clinivantage Healthcare Technologies, a patient can have an effective home care. Talk to us to know more.
So this is what we do with the self-care, where the patient is managing his own health using his.
Let us take a look at the assisted home care program provided by the hospital to their patients. This program is carried out with the help of various devices and portals developed by Clinivantage Healthcare Technologies. The assisted home care program is where a professional nurse of the hospital visits the patient's home to check his vitals and also to adhere to his complaints. Let's see how the process works. The hospital assigns an assisted home care program to the patient. A schedule of visits is created, and the nurse will visit the patient's home as per the scheduled dates. The visits can also be ad hoc if the patient has any complaints, and the nurse will visit the patient immediately. For ad hoc visit, the patient first takes an appointment with the nurse at the hospital. Once the appointment is fixed, the nurse creates an episode on the Clinivantage platform. The nurse then visits the patient's home to check the patients. The nurse also carries various smart devices like smart tablet, health monitor, ECG, portable printer, etc. The nurse checks vitals of the patient. She enters this data and other complaints of the patient. The nurse connects with a designated doctor via video conferencing. The doctor gives the necessary instructions to the nurse and the patient and then finishes the episode. The doctor also gives a prescription, which the nurse prints it on a portable printer. One copy of the prescription is automatically sent to the pharmacy of the hospital. The pharmacy delivers the required medicine to the patient's home. If there is a need of performing some tests of the patient, then based on the nature of the tests, necessary actions are taken immediately. For radiology tests, An ambulance is sent at the patient's home to take the patient to the laboratory, whereas for pathology tests, the nurse collects the samples of the patient for an advanced pathology test. She arranges for an ambulance to take the patient to the hospital. The vital data of the patient collected are updated to the longitudinal records of the patient, which are maintained at the hospital. In this way, by using smart devices and portals developed by ClinAdvantage Healthcare Technologies, a hospital can provide seamless and effective assisted home care to their patients. Talk to us to know more.
So these are the programs which we run to improve the engagement, improve the entire connectivity between the provider and the consumer. So improving the entire patient care management.